Hello, everyone. I'm Yaren. I'm a PhD candidate from Northeastern, and I'm an industrial engineering PhD student. Today, I'm going to talk about our paper that focuses on improving access to housing and supportive services for runaway and homeless youth. And our aim is reducing vulnerability to human trafficking in New York City. And this work is in collaboration with WPI and NYU. So, oops, I lost the mouse. So, before starting, I would like to give a brief description of what human trafficking is. Human trafficking is a malicious global rights issue that involves the use of force, fraud, or coercion to obtain some type of labor or a commercial sex act from an individual. And studies show that traffickers prey upon vulnerable populations. And one of the largest populations that traffickers prey upon are runaway and homeless youth. And they are youth and young adults living on the street without consistent or stable housing, and therefore they lack the community support structures to protect them against the societal and environmental trafficking risk factors. And these risk factors can be bullying, racism, physical or emotional abuse. And another study shows that took place in between 2014 and 16, and they collected data from a Covenant House, which is a large shelter that's in 10 different US cities. And they showed that basically 1 out of 5 runaway and homeless youth were victims of human trafficking. And studies show that access to appropriate housing for runaway and homeless youth is an effective answer to youth's vulnerability towards exploitation. And the reason that I'm emphasizing appropriate housing rather than just housing is that to be able to be an effective answer, these shelters need to coordinate these important services such as mental health support, healthcare, education, financial assistance, and legal assistance. But the problem is, in most US communities right now, the number of youths experiencing homelessness and seeking these housing services exceeds the capacity of the existing housing resources. So in this study, our population is runaway and homeless youth in New York City, ages between 16 to 24, and therefore we are in partnership with New York City Mayor's Office and New York City Coalition for Homeless Youth. So I'm just going to go into our model right now. The goal of our mathematical model is basically disrupting human trafficking networks to improve access to housing, like by improving access to housing and support services, so that we're reducing the number of potential human trafficking victims. And we have 2 objectives to achieve this goal. And the first one is learning the prevalence of those at risk of being trafficked and their associated housing and support needs. And this brings out our data collection process. And our second objective is projecting the required capacity to meet these needs. And I'm going to explain our integer linear programming model. And our data collection process is basically, we have 3 steps to collect this data. And first step is designing the survey. And with our survey, we're determining what services and capacities exist in these New York City shelters and organizations. And with our prevalence estimation, we're determining the size of runaway and homeless youth in New York City. And with clustering, we're going to create youth profiles to estimate these collective needs of youth, basically. So just to go into like a little more detail about the data collection process, currently we're conducting surveys with runaway and homeless youth in New York City, and we're going to have 500 in total. Currently we're at 200 probably, because as you can imagine, COVID-19 pandemic just delayed our collection process. But with these, after this collection, we're going to be creating these profiles. Currently, what we're presenting in the paper is just simulated data, since the data collection is not complete. But it is realistic enough thanks to our stakeholders. So what we're going to see in these youth profiles are we're going to have different youth profiles with different needs that they have here in different times. And these youth also belong to different demographic groups, as you can imagine. And just like these youth profiles, we're also going to have these organization profiles, and we're conducting interviews and surveys with runaway and homeless youth organizations to just identify the existing resources and capacities in their facilities. And with this, we're again, in this, you can see here, we have different types of services provided in different times. And one shelter does not provide the same service as another shelter. unfortunately. And also another thing is they accept different demographic groups. So most of the time you cannot put a youth from ages 21 to 24, it's the same shelter as a youth from 16 to 20-year-olds. Another thing that we consider in our model is there are two different types of organizations. One of them is the shelters that provide housing and support services, and sometimes they have to send youth to referral organizations like hospitals or mental health clinics and so on. So we call them just referrals. And with our ILP model, our objective is minimizing the cost of deploying extra capacity to these shelters while considering the overall value of placing youth to these organizations. So we consider the demographic of youth, the services that they request, the time that they request the service, and based on that, we match youth with organizations to estimate the extra capacity, extra resources needed. So this ILP model extends the multiple multidimensional knapsack problem, considering housing programs serving certain demographics, stochastic youth arrivals, stochastic stay durations of youth. This can also be, you can also think about this as a length of stay of youth, varying intensities and frequencies of services, services provided in periodic fashion and non-periodic fashion, and services provided within time windows. And runaway and homeless youth also might abandon the shelters because that's what they do. This is what this population does, like how we abandon the queue if we think that it's too long. So in this model, we have four sets. We have the set of youth that are receiving these services, requesting these services. We have the set of organizations who are our providers, and we are looking at time in terms of days. And we have these set of service intensity pairs, which I just want to explain briefly here. So every service provided are in different intensities, like every support services. For example, for mental health, we can have low, medium, and high intensity, which means that low intensity might just mean for youth that like they just wanted to get information about mental health and stress management. When it's medium intensity, maybe it is talking to a counselor once a week. And when it comes to high intensity, which requires more resources, more difficult to access resources, basically, receiving medication to help manage feelings, because youth will have to see a psychiatrist with the service. Yeah. So our decision variables here are X is our binary time-dependent youth organization assignment decision variable. U is the organization assignment variable, and it's not time-dependent. And E is our extra resource decision variable. Basically, we're trying to, with this decision variable, we project the number of extra resources that we can add within a facility, within an existing facility. And with the overflow shelter decision variable here, what we're trying to do is like shelters most of the time, as you can imagine, when they're at capacity and a homeless youth arrives, what they're trying to do is come up with a creative solution. They either give them a housing voucher or they give them a cot bed, which is not a stable housing, so like opportunity. Therefore, what we're trying to do with this decision variable is like we're assuming that there's one overflow shelter in New York City, and this anytime that they have to come up with a creative approach, we're sending this youth to this overflow shelter. That doesn't exist. And our objective is, like I mentioned before, minimizing the estimated cost of assigning youth to these organizations, adding extra resources to the existing facilities, and the cost of directing youth to an overflow shelter. I'm just going to go through our constraints very quickly here. And with the first constraint, we're making sure that we're not exceeding the expanded capacity of the facility. In the second constraint, we're making sure that we're not adding more resources to a facility than the facility can accommodate. And the third one, we're assigning youth to a single organization. And the fourth constraint makes sure that we are assigning youth to a single organization throughout their stay, so they're not jumping through shelters. And with the fifth, we're saying that if you're receiving a bed from one shelter, you should receive all the other services from that shelter as well. And the sixth one, just make sure that demographic of youth and the demographics accepted in the organizations are matching. And I also mentioned that we have some different things that like we're expanding the multidimensional knapsack problem with, for example, with the time windows. We're making sure that we're not providing services outside of these time windows. And we're providing service within the time window. And with this ninth constraint, we're saying that some services are non-periodic, so they can just like receive legal assistance twice a month. No one cares when this will happen. But when it comes to like mental health services or so, we want to make sure that they're getting their appointments like once a week, every Monday or every Tuesday. So periodic services. So this is basically our model, and we thought that we need to vary some of our parameters to just see how accurate we are. And therefore, we changed some of the parameters, and these parameters are like arrival rate, service duration, abandonment rate of youth, and with another scenario, we wanted to check the effect of the COVID-19 pandemic. And with all these, like, we used 10 different runaway and homeless youth profiles to see the variance, the captured effect of the variance. So when we look at here, when our baseline results, it is unfortunate that I have to say this, but we're assuming that in 6 months, 500 youth arrives to the system, New York City, and there are 8 organizations that they can go through, and they can provide youth 40 different services, which service intensities, but as you can imagine, like 13 different services, but 3 different intensities, high, low, and medium, and also in housing. When we consider these, what we saw was out of 500 youth, approximately 30% of them couldn't receive a bed. So when we look at this bar chart, the dark blue line, a dark blue bar shows us the number of youth who were able to receive an existing bed in New York City. And the light blue bar shows us the number of youth who were able to receive a bed that we just added to the facility, the extra resource. And unfortunately, this dark gray bar shows us the number of youth they had to be handled with a creative approach. So another thing that I want to show here is the psi that we have here. That's the number of youth who couldn't be placed to any existing organization in New York City because of their demographic mismatch. So I know I mentioned that we're using simulated data right now, but what we have seen in New York City is that for males who are 21 to 24 and with the children, they were not able to receive a bed in New York City, unfortunately. So let's look at our support services and how much more extra resources are needed in this. Again, we're assuming the same baseline inputs. And when we look at here, again, the dark blue shows us the existing resources that were provided to youth. And a blue bar shows us the extra resources that we had to add to the facility. And when the facility cannot accommodate more resources, they had to send youth to referrals. And as you can see here, referrals are pretty much like every service had to be provided with referrals almost. And the reason some of the services like substance abuse and childcare are not through referrals is that not many people are open to receiving these services. So what we see is like a large portion of medical, crisis emergency, long-term housing, which is basically the stable housing that New York City offers for youth, legal and financial assistance had to be provided through referrals. So those services specifically need more resources in New York City. And when we look at our abandonment rate and arrival rate effects, we see here is that in the most demanding scenario, when we increase the youth number to 600 youth arriving in 6 months, we saw that the number of youth who are not like we couldn't accommodate like went up to 35%. And when we look at the abandonment rate in the most demanding scenario where less youth abandons the system, which is 10%, again, 31% of youth couldn't receive a bed. So what we see here is, okay, I will just like talk about COVID-19 a little quickly too. What I want to highlight in this slide is that what we see here is the medical services. Like we all hopefully were able to access health services during COVID-19 if we needed. What happened during COVID-19 is that the number of staff who were working in these organizations decreased, as well as the number of youth arriving to the system. However, at the same time, out of 400 youth, 113 of them couldn't receive services still. And when it comes to medical needs, 85% of the medical needs of youth were provided through referrals. But what I want to mention here is like, when you refer a youth, let's think about a 16 to 24-year-old youth to a hospital, it's not likely that they're going to go to the hospital. So they might not have received these medical services. So what we have seen here is that even in the least demanding scenario, we need to expand the in-house capacity to its upper bound and add 20 more overflow beds. And 20 beds in New York City kind of means one shelter. And in the more demanding scenarios, we need to open more than one shelters in New York City. And we have seen that arrival rate and service duration have major effects on capacity expansion decisions. And in future, like I mentioned, we're gonna include the primary data to create these demographic and needs profiles. And also we're working on optimally locating these additional shelters. And also we're going to inform New York City Mayor's Office and New York Coalition for Homeless Youth's decisions regarding these effective expansions of shelter services. Yeah, thank you all for listening to me. And I can have your questions if you have any.
There's a question from the chat.
Yes. Hello, Sandra. So these youth, the question disappeared, but yeah, so currently what we're doing is like, we're basically going into shelters and reaching out to youth in streets in New York City to ask about like, what do you need from these New York City organizations and which demographic, like how do you define yourself? And this data does not exist, unfortunately. Yeah, that's the thing. I think, so this project is supported by NSF, and our major goal is to create, like, to have this data so that it will be accessible to for future use. So the simulated data is mainly, there are publicly available resources that like talks about the demographic of youth, and we also have stakeholders. So we're informed by them, and it was just, we have like monthly meetings with them and like show them the data, show them the models, show them the results. And we're currently getting, talking with New York City Mayor's Office. So yeah, we trust the simulated data, but however, our plan is to change it with the real data. Yeah.
One question.
I guess, thanks for a very interesting talk. I'm curious, what is your outcome measure, and how are you, determining that even with the simulated data, and how would potentially different outcome measures affect your results in those cases?
What do you mean?
I mean, so you're optimizing something, right, for putting specific youth of certain demographics into certain kinds of facilities. So
Yes.
What is that thing that you're optimizing, basically?
So what we're doing is so this capacity that we're also telling that like we need to increase is that the minimum amount of capacity, because we're basically like placing youth into shelters as effectively as possible. So what we're trying to figure out here is like, what's the minimum capacity that needs to be added to New York City shelters?
So I guess my question was, when you say as effectively as possible, what is the measure of effectiveness that you're using? Like,
okay. So what services do you require? Where do you want to receive these services? What time do you want to receive these services? We ask these questions to youth and we get these results. And like considering all their requests, what we're trying to figure out is like, how can we effectively match your demand? So I hope that answered. Yeah, thank you.
Okay, let's thank our speaker again.